back, everyone, to Einstein's Eyes. I'm your co-host, Carl Rosen, Oculoplastics, Neuro-Ophthalmology, Anchorage, Alaska, with my friend and co-host, Jon Ditkoff.
Hello, everybody. I'm Jon Ditkoff. I'm an ophthalmologist in northern New Jersey, been practicing for 31 years. And it's always nice to see you on our channel. And we have a great topic for you today.
So today we're going to dive into a really interesting new study about Alzheimer's disease, one that actually used nanotechnology to reverse Alzheimer's symptoms in mice. The story came from the New York Post. I was capturing headlines everywhere. Beyond the buzz, we want to explore what it might mean for your eyes, because believe it or not, ophthalmology and Alzheimer's are closely linked, more than you might imagine. When we look at the optic nerve, we're actually seeing the central nervous system. So let's start with the basics. Alzheimer's disease is a progressive condition, a neurodegenerative progressive condition where brain cells are damaged by abnormal protein buildup, things like amyloid beta and tau. And over time, this material, these molecules, the amyloid and the tau, can get in the way of the functionality of synapses and the central nervous system. This leads to memory loss, confusion, and difficulty performing everyday tasks. There was a lot of buzz, maybe 2018 or so, with a company, an Irish company called Elon, where they had an antibody against amyloid that was supposed to clean up the amyloid. It was called bapineuzumab. And in phase 2 clinical trials, it worked great, but then the data wasn't so great in phase 3. So that caused the space to lose faith in amyloid and going after amyloid. And then there was a big resurgence of tau, but now it seems to be back to amyloid. More than 7 million Americans are currently living with Alzheimer's, and that number could double in the next 25 years as our population ages. This isn't an obscure condition. It's something that every family is likely to encounter. This new study in mice used nanoparticles, tiny engineered molecules, to repair the brain's waste removal and vascular systems. Now, there's these cells called glial cells, astroglial cells, macrophages, that clean up this material, this amyloid and tau, so that it doesn't get in the way of the brain synapses, the brain conductivity, the electrical signals that go on and make you who you are. So think of it as microscopic cleanup crews that restore balance. Now, in mice, they saw about a 50 to 60% reduction in amyloid buildup within just an hour. Even more remarkable, over time, the animals regained memory and motor functions. Of course, mice aren't humans, and many Alzheimer's treatments that work in mice don't translate well directly to people, but it's a powerful step forward, and it helps us rethink how we treat neurodegenerative disease. And that's where our field gets interesting, because the retina, the light sensing tissue at the back of our eye, think of it like the film in a camera, is actually part of the central nervous system. As I mentioned previously, it's brain tissue you can see directly without an MRI or a CT scan or a biopsy. And that's why ophthalmologists are increasingly part of Alzheimer's research, using OCT, optical coherence tomography, which most ophthalmologists have in their offices. These scans and retinal imaging with a fundus camera can sometimes detect early changes that mirror what's happening in the brain. Thinning of the nerve fiber layer by OCT or reduced blood vessel density by fundus photography lend a hand and help us diagnose and stage Alzheimer's. For patients already diagnosed with Alzheimer's, the ophthalmologist's role is about preserving independence and safety. This means keeping vision sharp by treating cataracts, glaucoma, macular degeneration, diabetic retinopathy, because visual impairment can make confusion and falls worse. And we've all seen this. I mean, Jon, wouldn't you agree?
Yeah, I think years ago, I remember reading a study when I was in my infancy in practice where they took people before and after cataract surgery, and they showed their ability to comprehend their environment and their independence. And it was a very significant difference. So I think in someone who has borderline to maybe early changes from dementia or Alzheimer's, restoring their vision can make a big difference.
Visual impairment confuses people, makes falls happen more frequently. Depression happens when you can't see, you can't read, you can't watch TV, you can't see somebody's face. So when we perform cataract surgery and brighten things up with an intraocular lens. That makes a massive difference. We also help families identify visual processing issues, and some of the confusion at home that they can't answer themselves, we elucidate. Things like glare sensitivity or trouble recognizing faces, as I mentioned, that helps with the rehabilitation strategies. Now, from a research standpoint, we can contribute by monitoring retinal biomarkers with OCT or fundus photography, as I mentioned. If nanotech or other systematic treatments show human benefit, ophthalmologists are going to be on the front lines. We're going to help measure whether retina is improving or not, a real-time view of how the brain is responding. We're in a unique position to do that. What does this all mean? Well, it means the future of Alzheimer's care might not just belong to neurologists. It could involve ophthalmologists, engineers, nanotechnologists, artificial intelligence, machine learning, architects, all working together. And this underscores something we often say on this channel. The eye isn't separate from the brain. It's part of it. The central nervous system is part of the eye. So new discoveries like this show how treating one can inform the other. If you have a family member or a loved one dealing with memory loss or vision changes, an eye exam, an ophthalmology exam, they could offer insight, more insight than you might expect. If you'd like to learn more about how your eyes are reflected by brain health, or check out our previous episodes on neuro-ophthalmology and retinal imaging. Jon, anything else that you can think of?
That was very interesting. I think nanoparticle technology is going to be interesting for many diseases. I think the key thing, at least my understanding, is it can target specific cells, very different than when you take a medication. So I think the future might be really interesting to see what other diseases it's used for.
Thanks, folks, for being here. Please like and subscribe and share, and we will see you on the next one.